Hi everyone, thanks for joining us tonight. Really excited to have HLAA Executive Director Barbara Kelley with us this evening, along with Director of Public Policy Lise Hamlin and former HLAA Executive Director Brenda Battat. Before we get started, I would just like to thank Cindy Thompson from Alternative Communication Services for providing CART this evening. Thanks so much, Cindy. And I'm going to go ahead and turn this over to Barbara Kelley to get started. We have a lot of information to present, and I'm going to let her get started.
Good evening, everyone. Thanks for joining us. You know, HLAA and this organization has always been part of making history, and things are no different today because what we're going to talk about tonight is so exciting and really groundbreaking for people with hearing loss. We're talking about the National Academies of Sciences, Engineering, and Medicine report on hearing health care for adults, accessible and affordable health care and improving priorities for adults. And this report that was issued by the National Academies of Sciences is really groundbreaking. It's very exciting. And I just want to first start by asking, how many of you have heard of this, either through reading Hearing Loss Magazine or getting our HLAE news or maybe coming to our convention or hearing one of us speak on it? I just want to get the familiarity of the group. Hover your mouse over the check box and check yes if you've heard of the NAS report or no. Okay, there's a picture of the report itself. First of all, I'd like to talk about who the National Academies of Sciences are. The National Academies of Sciences and the Academy of Engineering and the National Academy of Medicine, all these together were formerly known as the Institute of Medicine. They work together to provide objective analysis and advice to the nation and conduct other activities to solve complex problems. And their research and the reports and their information is also used to inform public policy decisions. So they have issued this very important report on accessible and affordable health care for adults. And nobody really has to do anything with this report, although you know HLAA will, but it carries such weight and such prestige that it becomes essential to people like Congress and the White House, who have formed legislation and executive orders on recommendations that the National Academies of Sciences have provided. So that's why we're really excited about this report. We have known for years that hearing loss is a primary health concern and that its effect on people who have untreated hearing loss can cause isolation, depression, comorbidities, falls. But now we have a report backed by science and a study that says this. So we want to talk about HLAA's role in this important study. First of all, the Hearing Loss Association of America was the only consumer group sponsor of this report. The other sponsors were the FDA, the Department of Defense, the U.S. Department of Veterans Affairs, the Centers for Disease Control, the Hearing Center of Excellence, which is part of the Department of Defense, the NIDCD, which is part of the National Institutes of Health, which is the National Institute on Deafness and Other Communication Disorders, and the other Institute of Health, which is the National Institute on Aging. So as you can see, the other agencies were government agencies, and we're the only consumer group sponsor. So this is very important because this is what this study focused on, was consumers, people with hearing loss, and more specifically, adults with hearing loss. We will get into the recommendations in the study in a few minutes, but one of the things that HLAA is doing as a result of this study is that we will take the lead in creating public awareness for consumers for hearing loss and about hearing loss. And depending what turn or what recommendations come to fruition, we will be educating consumers about that as well. And maybe just as importantly, or more importantly, HLAA has always advocated for people with hearing loss. So we will be advocating and working for public policy to adopt the recommendations of this study. So this is pretty important, it's pretty groundbreaking, and I am so pleased to introduce our next speaker. Brenda Battat, who is a former executive director of HLAA, spent about 27 years here, not only as executive director, but working in advocacy and public policy. And I think it is a great, fortunate circumstance that Brenda was on the committee for accessible and affordable health care that studied this. So she has the insider view of talking about this report and talking about how it came about. So Brenda, I would like to turn over the program to you at this point and continue. Thanks.
Thank you, Barbara, and good evening, everybody. I'm really delighted to be here, and it was actually an honor for me to participate in the committee's work, the National Academy of Medicine's work. I want to give you some background. A few years ago, the National Academy of Medicine conducted a two-day workshop in Washington. And during that workshop, they identified hearing loss as a huge public health concern. The other issues that emerged during that workshop was, why is the impact of hearing loss so underestimated? And there were clearly barriers to access for people with hearing loss to seek help. High cost, lack of insurance coverage, stigma, limited awareness of existing options for care. And as a result of that workshop, the National Academy decided to delve more deeply into the issues, to look at affordability and accessibility, and they formed a consensus committee to look at these issues for hearing health care for adults, 18 years and older. And as you can see on this slide, if you want more information about their work, there's a website right there, www.nas.edu/hearing. The committee was composed of 17 professionals from a wide variety of specialties: law, psychiatry, health policy and economics, otolaryngology, family medicine, gerontology, rehab specialties, consumer advocates. And we met for a year, and we researched the issues thoroughly. And we also benefited from comments from all the key stakeholders. Over a period of a year, we would have meetings every other month, and they were open meetings where people could come and present their ideas and their comments about these issues. We also received many written comments. And the result of all this, we put everything together and came up with a report that had both findings and 12 recommendations. And the goal of the report really was to increase transparency for consumers, to expand treatment options, to make sure that the approach to treatment was patient-centered rather than the old medical model, and to examine various healthcare delivery and payment options. So if we look at the recommendations one by one, you're going to have them on the next 4 slides, but I'm really going to just summarize each one for you to explain a little more what it meant. The first recommendation was we found that there was very little solid data about hearing loss and the effects of hearing loss on patient outcomes. So we are strongly encouraging that there be more data collection through research. We want to also promote best practices in hearing healthcare, even though audiologists are trained in best practices, and on the audiology professional associations all have guidelines related to best practices. They are not currently carried out universally nationwide. The third recommendation was to remove the medical evaluation before you have a hearing aid fitted, or sign a waiver. And the reason for that is that already it's not being actually carried out the way it was intended, because most people just sign a waiver anyway. So that was one of the recommendations. The recommendation 4 was to make sure that patients understand their rights regarding having access and being able to take away their audiogram and their programming history so that they can go from one professional to another. The use mechanisms to reach rural and underserved populations. So looking at things like telehealth, community healthcare centers and community health workers to reach more people that are underserved. And also increase diversity in the hearing healthcare workforce so that professionals look more like many of the patients that they would be treating. And the number 6, recommendation 6, was to promote hearing health in regular medical wellness visits. So when you go to see your doctor, make sure that they do ask you about, particularly older people, ask about your hearing concerns. And particularly with the Medicare annual wellness visit. And talk to family members, talk to caregivers and individuals themselves, and refer as appropriate, and also to expand the continuing education for primary care physicians, because we listen to our primary care doctor, and if they tell us we should do something about our hearing loss, the chances are that we will do it. In the recommendation 7, was to establish a new category of over-the-counter devices. This is quite a major recommendation. It's actually introducing a whole new category under the FDA regulations. What it does is it provides more entry points for consumers to seek care. It provides under the FDA quality and accurate labeling. It will allow honest marketing to hearing people with hearing loss, unlike the current PSAPs, which are not allowed to market to people with hearing loss. It would allow for self-adjusting hearing aids for people who want to do that, and also hopefully will lower cost. So we felt there were many advantages to an over-the-counter type of device. Recommendation 8 was to make sure that there's compatibility with other technologies and communication systems such as phones, and also to open the platform, the software, so that if you buy a hearing aid for one person, then you can go and have it programmed by another professional, and not be locked into one person, particularly if you move, relocate, or perhaps you just want to change your provider. And then the other issue was affordability. First of all, to have transparency so that professionals explain and advertise how much the device costs, how much their services cost, so that you know exactly what you're paying for. And that there would be, we request in this recommendation that Medicare evaluate options for coverage, both for the device and also for oral rehabilitation. Medicaid also likewise. Vocational rehab should promote their services more. Many people don't know about vocational rehabilitation. And private insurers, employers, and Medicare Advantage plans should evaluate options for providing beneficiaries with affordable hearing health care. And then one more slide. There are 12 recommendations altogether. There's a lot of them. But I think they covered hearing health care is a very broad field, and we felt that there were many areas that needed some tweaking. So number 10 was looking at, again, innovative payment and delivery models, community healthcare workers, mobile health, retail clinics, patient-centered again, and when effective models were discovered, that they should be implemented. And then improving public awareness about hearing healthcare. Many people still don't understand about hearing, and they certainly don't understand about what's available for helping them. Then talking about hearing protection, how to seek care, how to get help from peer support, such as HLAA Chapters, and then compliance with existing disability laws, such as the ADA, both in the workplace and everyday environment, for things like hearing-assisted technology. So we didn't only look at the individual, but we also looked at the environment and what was needed to help people hear better in the environment. So that, in a nutshell, and very briefly, trying to help you understand what the findings were and what the recommendations were from the National Academy of Medicine. And I think that concludes my coverage. I think now we're passing over to Lise Hamlin, who's Director of Public Policy with HLAA, and she will tell you what has been going on since the publication of the report on June the 2nd of last year. Lisa?
This is Lisa Hamlin. Hi all. Thank you, Brenda, for starting us off here and giving us an overview of what was in NAS, the NAS report and the recommendations. I'm here to tell you what HLAA will be doing and has been doing with the recommendations since they've come out. And this just briefly are the things we're going to cover. We're going to talk a little bit about the medical waiver that Brenda mentioned as part of the recommendations. We're going to be talking about over-the-counter hearing aids, talk about standards and educating consumers about PSAPs, personal sound amplification products, and the over-the-counter devices, as well as our public awareness campaign. So we're going to start with the Over-the-Counter Hearing Aid Act of 2016. One of the first things that came about after this report was published, and if you recall, Barbara was talking about how members of the legislature, that people in the government are looking at these reports. That's really the powerful nature of the report. So Senators Elizabeth Warren and Chuck Grassley got wind of the report and took a look at it and said, you know, we can do something about this. So they introduced a bill last fall called the Over-the-Counter Hearing Aid Act of 2016. Now, the legislation would make some types of hearing aids available over the counter and remove many of the barriers for consumers who could benefit from hearing aids. Some of the things, one of the reasons, if you look at that, one of them motivating. We have been talking, Hearing Loss Association of America met with the staffers in both Senator Grassley and Senator Warren's office, and some of their motivating factors why they put this together was they said that it was clear when only 20% of the people who need hearing aids, who could benefit from hearing aids, actually purchase them, something has to change. And this is one way to make change happen quickly. Now, we know the technology is totally different now than it was 20 years ago, certainly, and even 5 or 10 years ago. So some products now can be made, quality products out of the box, that could be self-fitting hearing devices. For people, again, we're not looking for everybody to have these things. These would be devices that were meant for people who have a mild to moderate hearing loss. It's a first step. It's a entryway into the market until they need something, until they find they need something more complex. And we've found that it's possible at this point to build something that's more affordable. That's the other piece. The concept is you don't want over-the-counter just to have over-the-counter. We want to see something that is more affordable. So we have a whole range of price points, all the way from real entry-level device to something that's a real hearing aid that has a lot of bells and whistles that would benefit somebody who can use it and need it and understands how to use it. Now, as I said, these devices would be a pathway with the beginning, the first step. The other thing that we see is we think that it's still usually important for audiologists and hearing instrument specialists to be part of the picture. We know that they can provide anywhere. If they provided the early entryway devices, that would be fabulous. If they provide the whole range of devices, we think that's a wonderful way to actually use the skills and the knowledge of these people, the professionals. But what we also see is there may be a way for people to get these devices over the counter or online and then come to your audiologist, but only if the practice changes from the old model of bundling everything together so that you get both your services and your hearing device all at once, to somebody coming in with a device and you going to the professional and saying, can you help me? Can we do more with this? Is this the right device for me? And we could work with this model, and we're hoping to see more audiologists and hearing instrument specialists decide that this is a good model for them as well. It's really, and we see this moment has changed. Technology has changed. The number of people who are aware of their hearing loss and want to do something about their hearing loss has changed. The whole industry is on the edge of change. And we think this is a huge opportunity for people with hearing loss to actually get the benefit of products, again, a whole range of products from entry-level, low-cost products to the more expensive and more sophisticated products that some others of us will need and want to use. Now, one of the other things that happened was one of the recommendations was, as you heard Brenda talk about, was that all of you who have gotten a hearing aid, now that one of the things that you do when you go into an audiologist's office, if you have not already seen an ENT or a doctor, you must sign a waiver that says, I do not need to see a doctor. I'm waiving my right to see a doctor. It's a federal regulation, and most states have picked it, and all states have picked this up. What the FDA did when they saw the recommendations is they took a look. And what's happening is more people sign these waivers than do not. There are very few people who decide that they want to. They go to the audiologist, they see this and say, no, I must see the profession, the doctor first. So if it's not being used, if this regulation is not being used and we're not hearing of bad results coming of that, it makes no sense to have this regulation. So the regulation is still on the books, but the FDA said we will no longer enforce this regulation. So if it turns out that somebody goes into an office now and somebody says that they're not signing the waiver but still have not seen the doctor, then as long as, again, nothing bad happens, then the FDA is not going to come in and tell the audiologist or the hearing aid dispenser that they're in violation of the law. They're just not enforcing that portion of the law. We also believe that this is probably effective also because we know most audiologists, well, all audiologists are aware of what are called red flags. And most consumers, we find, know that if something happens, if you wake up one morning with no hearing in one ear, you're not going to run out and get a hearing aid. Most people go right to their doctor. If there's drainage, if there's bleeding, if something's happening that's a trauma to your ear, chances are you're going to go to the doctor. But if you end up at an audiologist or a hearing instrument specialist, they will know these red flags and say, you want to go see a doctor before you go in and buy a hearing aid. So that's the practice, and we believe it's working. And so this will make it takes away a barrier so you don't have to take an additional step to get you before you get some kind of hearing device. We will continue to work with FDA. FDA is also looking, even though the legislation has been introduced, the legislation I was just talking about for over-the-counter hearing aids was introduced last year. We have a new session of Congress. It will have to be reintroduced this year. At the same time, the FDA is looking at the possibility of simply creating regulations for over-the-counter hearing aids. So it could be done through legislation, it could be done through regulation. We'll work with both the legislators, and we'll work with the FDA to see this path forward so that we can see what happens next and how we can move the process to have more affordable hearing aids. We're also working with the Consumer Technology Association. Those are people who have been building some PSAPs. They are on the cusp. If we have this new category called over-the-counter devices, they are ready to work into that direction too. So they're very interested in seeing the fact, again, there's so many people who are not getting hearing devices. They're looking at it and say, there's a market there, maybe we should step in. So the first thing they did was CTA put together a standards group to create standards first for PSAPs, because at the time they started there was no, and there still isn't a category of over-the-counter. It's not there yet. So for PSAPs, CTA has worked with a group of industry professionals to put together standards to create basic recommendations, so we know if somebody creates a PSAP that they're following certain procedures. And I've just been asked what a PSAP is, and a PSAP is a personal sound amplification product. What it is these are the small devices. They often look a lot like hearing aids. They're small, they're basic. You can actually see them advertised and sold sometimes on the internet. You used to also see a lot of them on the back of Parade magazine. And for many, many years, if you were seeing them 20 years ago, everybody ignored them because they would cost $25, $100, and they knew they basically didn't work. They were just a straight amplification. But now, again, technology has gotten so good that some of these PSAPs are quite good and quite workable. So this group got together and said, okay, what should be in a basic PSAP? And they created this, the body has created these standards. They're ready to go to ballot. It will be voted on by other standards group to make sure that this is the voluntary standards that should be adopted. And if they're adopted, then again, these are not regulated at this point. So they would be, anybody who follows the standard could say they are. So there would be a separate group that will look at, okay, so how can we label this in a way that consumers will know what it means when somebody followed a standard? Or they can know that if somebody else is saying, well, I'm going to ignore the standard, I'm just going to make something that I think is okay, it may not be as good quality. So HLAA will be part of educating consumers to make sure they know what the difference is between those products that follow standards and those that do not. And finally, the things that we're going to be working on is a public awareness campaign about hearing health care. What is it? Why should people be aware of it? Why should doctors be aware of it? Why should people in the area and across the country know about hearing health care? What should we know, and how can we make it really an issue that matters to everyone? So Hearing Loss Association, this is one of the recommendations, and Hearing Loss Association America will be absolutely on the forefront of making sure that people will get the information they need across the board on this topic. There's one other piece that you should be aware of. We've posted this already, but it's coming out soon, and this is only, the Federal Trade Commission people came to the NAS meetings to hear and listen and to find out what was going on. Again, remember, not only did legislators look at the NAS report, but now other regulators said, what's going on? What should I know about what's going on in the hearing healthcare field? So now the Federal Trade Commission will be holding their own workshop, their own day of looking at what does the industry look at? Are there barriers to buying a hearing aid for people with hearing loss, and what should be done about it? So that'll be held in April. You can find out more information about that either through our website or going directly to the Federal Trade Commission. Look for Now Hear This, Competition, Innovation, and Consumer Protection Issues in Hearing Healthcare. We're really looking forward to seeing what will develop from that as well. I'm going to turn this back over to Barbara now, who will moderate the questions that are coming forth from you guys. You can, any question, we're ready to take it. Go ahead. Go ahead.
First question.
Okay. All right. I'm going to read the first question. First of all, I want to make a couple comments that HLAA represents consumers. The FDA, the Food and Drug Administration, the Federal Trade Commission, audiology groups, legislators like Warren and Grassley are coming to us. They are seeking our input. They want to know what consumers want. And this is so important that we are the consumer group. We're the only consumer group in this whole picture of these recommendations. And that's why we are playing a really big role in this. It's a very exciting time. It's an exciting time for people with hearing loss, untreated, and people who have hearing aids. And these recommendations are going to serve as a blueprint for HLAA's work going forward. We will continue to keep you informed. We've been doing that through the magazine, through our press releases, through our e-news, and this webinar is another step in that. But at our convention this summer in Salt Lake City, we will be having more presentations. We will keep you updated on what is happening. Some things could happen very quickly, like the FDA not enforcing the medical waiver, and some things can be very slow. But we are the consumer organization, and we, all of us together, have the power to make good things happen for people with hearing loss. So you have to stay with us. This is going to be could be a very long ride, but there's going to be progress. So please stay with us, because there are going to be times when we're going to need you. We're going to need our grassroots. And we will let you know when that is. But please stay with us and stay informed. Okay, let me take the first question. Let's see here. I just have to scroll. There's two questions now.
Okay.
Well, I'm going to take the question that I can see. Maybe you can come around. It says, I remember how the AAA was against us with the insurance issue years ago. Any resistance here? AAA is the American Academy of Audiology. And funny you should ask that. I've been following what the AAA has been writing about this in their magazine, and their board chair, who is Ian Windmill, has basically been writing, change is coming. Let's look to the change. Let's think about this change and how we're going to be part of it. I just had a talk with Ian Windmill yesterday, and he's going to present at our convention this summer in Salt Lake City. The American Academy of Audiology says there's a lot of unknowns. And there are unknowns. We're going to have to get data on over-the-counter wearable devices, if they work. But they generally have a very open mind. They know that technology is booming on the scene. They see the market share opening. They know that these people with mild to moderate hearing loss aren't seeking the care of audiologists anyway. They're seeing the people with more severe and complex hearing loss. But I don't want to speak for the Academy. But Dr. Windmill said that they will be issuing some statements about some of these recommendations. They really are studying this. They're looking very carefully at it. They know that they have audiologists who are all for this, who want to open up their businesses and carry a spectrum of price points for consumers. They have people in the middle who just aren't sure yet. They're going to wait and see. I mean, we really have to wait till the FDA opens up this category before we really know the specifics of it. And then, of course, there are professionals who are against it, because there is this business model that has worked for 40 years. But we couldn't even have this conversation 10 years ago because the technology wasn't there. So they will be issuing some statements that I think will be very encouraging, and the Academy wants to work with us on the consumer information piece. In fact, we would all like to come up with one message, like the phrase, "got milk." When we all see "got milk," what do we know? We know milk is good for us and we should drink it, and it's nutritious for a healthy lifestyle. And we all want to be together in this message, not everyone having a separate message. So we're very encouraged about the Academy's response to this. There are other audiology groups like the Academies of Doctors of Audiology who are for opening up an over-the-counter wearable device. The American Speech Language Association, we haven't heard from yet, but they are throwing their support behind a tax credit for hearing aids, which is a tax credit. It's been introduced many, many times, and the bill hasn't gone anywhere. It's I think a tax credit you can only take every 5 years, and that's if you itemize your taxes and are due a refund. If you get everything totally refunded, you know, the tax credit isn't going to work for you. So we really haven't heard from them, and I don't want to speak for them. But we see some progress in the audiology profession, and I think the signs are there that technology can do this. But we all want standards. We want the devices to be safe. We want them clearly labeled. We want people to be educated. And we want people to understand realistically that any kind of hearing aid is not going to correct your hearing loss. And people say, well, what if you get a bad over-the-counter device and it doesn't work and then you're turned off forever? Well, don't we all know people who pay a lot of money for their hearing aids and then they end up in a drawer and they never wear hearing aids again? And I think many of our members who have had, we value our audiology professionals. We've had good experiences with them. Many of our members have more severe to profound hearing loss and need some complex fittings. We're not talking about that group. This is the group of people with untreated hearing loss, mild to moderate, who might never go to an audiologist because of cost or because of it's too complicated to get through the system, but they might try like this little entry, you know, put their toe in the water with a device where they might get some help. Let's see, the next question says, has a study been done regarding consumer satisfaction of those who have tried PSAPs? Is there a general level of satisfaction? Is there frustration when they fail to help or if they further hinder the ability to hear? Well, one of the problems with PSAPs is because there have been no standards, there's all kinds of things on the market. I have heard that there's some very good PSAPs, and then that they're very good PSAPs, and then there's junk. But the problem with PSAPs is they cannot be marketed to people with hearing loss. They can only be marketed to somebody who wants to hear better in some situations. They always use the example of the hunter who wants to hear the deer in the woods. So they can't even market them to people with hearing loss. So there's no way to do a study if people have been satisfied. And this has also been very confusing to consumers. And it also kind of adds to the stigma because it's like, this really isn't for hearing loss, but you might try it. So PSAPs have caused a lot of confusion. The Academy's report does not deal with PSAPs. We are talking about PSAPs because we keep our eye on everything, and we know about the technology industry. But the report doesn't deal with PSAPs. It only deals with opening a new category of over-the-counter hearing wearable devices. They're not even calling them hearing aids. Now, the Warren-Grassley bill calls it the Over-the-Counter Hearing Aid Act, but we really don't know what this is going to look like. It's really up to the FDA. And that's kind of what we're all waiting for. And believe me, HLAA is not waiting. We are talking with the FDA. We're talking with Warren and Grassley, as well as some other people. So, no, there is not studies. Let's see. One concern I have with over-the-counter hearing aids is that audiologists will lose potential clients. I have a severe to profound loss and require custom molds. I feel my costs will increase due to the audiologist reduced market. Well, I'm not an economist, but there is some thought that the market will expand. And that's kind of what the audiology groups, especially the American Academy of Audiology, are thinking, that some of the people who start with an over-the-counter aid, that just might be their first step, and they could very well end up in the audiology practice with needing hearing aids. The other thing is audiologists, some of them already want to carry lower cost hearing aids with a wider spectrum of price points to give consumers choice. And if they unbundle their prices, they might very well be helping somebody who bought an over-the-counter device, and that person might end up with them. So, there's an example of Uber. Do you remember when Uber came out and everyone thought that the taxi cabs would go out of business because Uber and Lyft were going to take all the business? Well, I just heard at the Consumer Electronics Show last week that the whole the taxi cab business has expanded when they thought it was going to shrink. So it's kind of like the market grew. And like I said, I can't predict what the market's going to be, but with more people getting used to getting hearing help, and people who would never even think about it, and think of the younger generation coming along who are used to putting earbuds in their ears and maneuvering things on their smartphones. There's a whole generation of people who probably will get help who might not have before, which I think is going to be good for the marketplace. It's going to be good for eradicating stigma. It's going to be good for public awareness. It's going to be good for venues to provide accommodations. It's not going to be so, out there and foreign to people. The next question is, what about that all-day NAS update workshop last month? Did anything new come from that? Yes, that was held in December, and I might let somebody else take the question just so I'm not doing them all, but that was held in December, and all the stakeholders were there. The hearing aid industry was there, audiology groups were there, the federal government agencies were there. We were there as a consumer group. AARP was there. And then we broke out into breakout groups. One of the big things that came out of that workshop was the FDA announced that they would no longer enforce the medical waiver. Another big thing that came out of it, that HLAA is going to take the lead in the consumer information piece about public awareness of hearing loss. And we're going to work with all the groups who want to work with us. We know this is a long-term campaign, and it's going to also depend a lot on what type of technology comes out. If there is an over-the-counter wearable hearing technology, we're going to have to be part of a lot of education in that. So it was very productive. Also, the FTC was there, and they listened to comments from the hearing aid industry. They listened to comments from us, who was the consumers, and they listened to audiology groups. And I think they went away, and this workshop that the Federal Trade Commission is going to hold in April came out of that, because they were there listening, and they want to know what's happening in the market. So they're doing, they're trying to gather their own information.
I'm not sure you want to answer that.
That one? Okay. Is there another one? We got lots of questions. Yeah. I love this. See. Okay, we have a question and would like you to clarify it. Maybe I'll let Lisa answer this one. And Brenda, of course, you're happy to pipe in. The question is, don't you think a study would be critical before advocating a rollout program? And I think you might be talking about a public information campaign. Is that what you're talking about? If you could please clarify.
Or maybe a rollout of over-the-counter?
Or do you think, could you clarify that? Do you mean rolling out over-the-counter hearing devices or rolling out a public information campaign? Well, if it is an information campaign, then yes. This
rolling out hearing devices.
Oh, rolling out hearing devices. A study. Lisa, do you want to answer that one?
Toss it to Brenda, because that's what the NAS was looking at.
Brenda, I'm going to toss this question to you. This person wants to know, don't you think a study would be helpful before the FDA considers opening the market for an over-the-counter wearable device? Brenda, will you take that one?
Yeah, I'd be happy to, Barbara. I think the way that the recommendation is written in the report is very carefully crafted to make sure that the devices would be safe and that they would be effective, the minimum standards, and there's a lot of provisions for safety. So I really, I'm not sure what kind of study you would have in mind, but I think the best way to do this is to roll them out, making sure that we have all those things in place, that there can be no harm, and that hopefully they will be effective, and that they will be regulated by the FDA. This is not just going to be like a Wild West situation. They're going to be regulated by the FDA. I think after rolling them out, then it would be possible to do a study. I think it would be extremely hard to do a study before. And I'm sure there will be many studies done after they're rolled out, and we'll get an idea about how they are actually working for people. I will say that in other countries that have over-the-counter devices, the satisfaction level has not been high, but the issue there is that they don't have any standards and they're not regulated. So I think that's not surprising that they wouldn't be very satisfactory. Basically, it's like the kind of thing we used to have in Parade magazine for $20, junk. And we are not advocating that there be junk put on the market. We're advocating for very effective, safe, quality devices. So I think in answer to your question, there will be lots of studies done, but I think it has to be done after they're rolled out.
I've been asked to take the next question. The question is, will the over-the-counter seller know the buyer's audiogram, or will they be able to tell them if the product will help their degree of hearing loss, or if their loss is too great to be helped? Now we're talking about something that hasn't happened yet. So we don't know exactly how things will roll out. From our perspective, the important thing is, again, what Brenda just said, that we have standards, that the devices meet the standards, and then that there is labeling so that the consumer understands what this product is good for. For example, there are now phones that meet certain standards. There are phones that increase the volume up and beyond what your typical phone would do. They're meant for people with hearing loss. Those phones that meet the standards have a label. they go on the label and you see, well, this phone is good for me. It increases at 20 dB, it increases 50 dB, whatever it is. Then I know if my hearing loss is compatible, and it has an explanation. We anticipate the same kind of recommendations that will happen. There will be standards that you can see on the label if it meets the standards. You can see also on the label who this is intended for. And then, if you have a question, that's where we want to see our audiologists come in. That's where we want to see the hearing instrument specialists that say, this is intended. If the labels are proper, do I, as a consumer, know what it means? Do I know what my hearing loss means? Do I know that I have a mild to moderate hearing loss? These are the kinds of things that you can, if we separate, if we unbundle the services, so we go to an audiologist, they can test my hearing loss. They can test it, and they know, and they can explain to me what we have, and then I can decide, do I need to get a hearing aid in that audiologist's office? Am I happy working with them? Or do I want to save some money and go over the counter? So that's what we anticipate. But again, we don't know yet. That's what we're looking for. But what we want is as much consumer education, as much consumer protection as we can. The next one is there a timeline for the rollout? Not yet. We don't know. We're waiting for the FDA, Food and Drug Administration, which has oversight on hearing aids, to come up with recommendations. If they get to a point where they know which direction they want to head in, do they want to create new regulations? Do they want to create old interpretations of the regulations, the rules that stand now? We don't know where they're going to go. Once they have a sense of which direction they're going to go, and once we have a sense of whether, in fact, that the legislation could take off, then we'll have a better sense. But I wouldn't expect anything happening tomorrow. I think these things will take time. Even the standards for the PSAPs took, I believe, 6 months to a year. We would expect the same kind of rollout, slowly and carefully, so that people are still getting products that are good for them, but as Brenda said, we don't want to see junk getting out there.
Thank you, Lisa. That was helpful. I did see a comment which was excellent. It said, I made the analysis to Uber and taxi cabs to the hearing aid market, and someone said, but this is not a car, it's a health issue. It absolutely is a health issue. And untreated hearing loss is a major health concern in this country. I was just using Uber as a business model. So far, for the past 40 years, the business model has been based on low volume, high cost of hearing aids. And those of us who are old enough to remember when computers first came out and cell phones first came out, they were only for people who could afford them because they were pretty expensive, or who were smart enough to operate them. Well, we know what happened to cell phones and computers. They're called market disruptors. The technology went so explosive that they became affordable and they became so good that everybody could have them. So I'm just using that business model to make some comparisons. The Consumer Technology Association will, and I don't want to speak for them, but they kind of treat a hearing wearable device as technology. We do know it's a health issue. It's just not a matter of putting something in your ear or using an assistive device. We know that hearing loss is much more complex than that, and that's where a good audiologist or hearing instrument specialist will assess the needs of a person and talk about where they need to hear best. Are they in the workplace? Are they in a retirement community? Are they a student? And what types of assistive listening systems would they use? And do they use telecoils? So hearing loss is just not about the device. However, we are talking about people with mild to moderate hearing loss who may never do anything about their hearing loss. And this this would give consumers more control over their own health, and that's the whole medical model now, is going to consumer-centered care. Consumers make decisions along with their doctors, but they're part of the decision. And right now, consumers are really at the mercy of gatekeepers of this technology. So, as I said, I'm not an economist, but there's a lot of speculation how this could open the market and allow more affordable and accessible hearing health care. But you're right, this is a health issue. It's not just about the device. Any more questions?
Your time for approvals rollout.
Oh, here's a good question. Will interoperability of technologies take the place of proprietary software? That is one of the recommendations in the NAS study. Oftentimes you will go to your audiologist or hearing instrument specialist, and they are the only ones who can program your hearing aid, and that's it. The NAS recommendations recommend interoperability. So if you buy your hearing aid one place, you should have access to your program, your audiogram, and you can get that hearing aid serviced anywhere or get treatment anywhere. So that's another recommendation. There's another question. Will there be a lot of staff changes in the FDA and FTC with the changes in administration? There's really no way to predict that. Like any transition in political power, sometimes the chairmen of agencies will stay on at the pleasure of the president. Sometimes there will be a new appointment. But we hope, well, the people we work with are the staff. And even though the FDA may get a new chairman and the FTC might get a new chairman, the staff will remain the same. And it's the staff who are working on these issues. So we'll just keep working along. And as I said, this is just the beginning. You know, stay with us. We're going to keep you informed. Some things could be short-term. Some things are going to take a long time, but we have to be there. We are the consumer organization. We represent consumers. And if we're not there, all these recommendations really mean nothing. So I want to thank everyone for tuning in tonight. I think we're out of time, and there's a lot of good questions. But we'll do this again, and keep reading the magazine. Watch our e-news, watch our website. We will keep you updated, and we're happy to answer any calls. This really is a focus of our work going forward. So I want to thank you to Brenda Battat, who we're so lucky she served on that committee, because she's a consumer and she's an expert, and we're all have a big thank you to her. I want to thank Lisa Hamlin, our Director of Public Policy. The recording of this webinar will be available, and we will get it posted as soon as we possibly can. We like to make sure the captions fit the text, and we will get that up. And please tell people about it, because this is such an important topic.
Here's the PDF.
Oh, excuse me. We will also post the PDF of the PowerPoint, and you can get a lot more information on the NAS website. And I believe that's in the PowerPoint as well, but it's nas.edu/hearing. And you can download the recommendations, and they're put into layman's language, and they're very easy to understand. So I just want to thank our captioner. I want to thank everyone who came, and thank our presenters, and stay with us. This is very, very exciting times for consumers. Thank you.
Okay. I don't say anything. Yeah.